Morning, Miss Rhonda. Good
morning, this is Scott Olander.
Hey, Scott.
Good morning, Scott.
Good morning, this is Jennifer Allow.
Good morning. Jennifer, where are you from?
Richland.
I work in education. You work for the Richland School District?
Correct. I sure do. And yourself? What about you, Carol?
I work for Greater Columbia, GCACH.
Yeah. Nice to meet you.
To meet you too.
We'll give everybody just a few more minutes and then we'll get started.
Thanks, Vicki. So just curious, how you got linked into budget and funds flow?
I had attended another community meeting and had run into someone who works with another person who knew about this opportunity as far as the need. There's a need for committee members. And so I provide my information and the rest is history.
Yeah.
In a nutshell.
Carol, it was actually Ruben that recommended her for the committee.
Okay. Well, that would explain why I didn't know.
She was one of our new members, one of 3, I believe, that we brought on last year.
Nice. Yeah, we just haven't had the opportunity to meet. Literally.
Yeah, I think Victoria was the other one, and then Carrie Isaacson, but she's now gone, so she's not on the committee anymore either.
It happens. People come, people go.
I know. Yeah,
Life
it's one of our agenda items today. Well, so should we get started?
Sure.
We're at 10:03. So thank you all. Welcome. I know we haven't met in a really long time. We're approving minutes from February. So that tells you how long it's been since we've met. Let's do a quick welcome and introductions. I'll start. I am Becky Coleman. I am the Director of Finance and Contracts, and so this is kind of my meeting. And normally we have a chairperson, but he also has resigned and left the corporate company that he was working with, so he's no longer on this team. So one of our agenda items is to collect some nominations for a new chairperson. We'll talk about that a little bit later. So, Chelsea, do you want to run the introductions or do you want me to do it?
I would be happy to. So, yeah, so I'm Chelsea. I am the administrative assistant with Greater Columbia, and I'm just going to go down the list. If you want to say your name and organization, that would be great. Carol?
Hi, I'm Carol Moser. I'm the Executive Director of Greater Columbia ACH.
We have Jennifer Allow.
Hi, I'm Jennifer Alford with the Richland School District, family advocate / teacher, and so happy to see all of you, or hear your voices at least.
Welcome. I just see Rhonda's gonna log off and log on. So we'll wait until she comes back. We have Sam.
Hello, Sam Riddell. I'm the Director of Practice Transformation for Greater Columbia.
We have Scott Olander,
Yes, I'm the CFO at Kittitas Valley Healthcare in Ellensburg.
Sulamita,
Hi, I'm the Finance and Contracts Coordinator at Greater Columbia Accountable Community Health.
Susie Diaz,
Good morning, Susie Diaz, Heritage University.
Victoria,
Hello, Victoria Bryan with Ideal Option.
and it looks like we have Rhonda back. Hello, Rhonda. All right, so I think that's it. If I didn't call you, if I didn't announce your name, please do so now. I think that's Rhonda trying to dial in. Okay, Becky, I think you're good to go.
Okay, great. Thank you, Chelsea. So since as I mentioned, we don't have a chairperson, I'm going to just run through the agenda. So the first item is to approve the minutes from February 2020. I don't know if any of you had a chance to review it. I'm sure that I don't remember what happened until I read the minutes. So hopefully y'all read the minutes and we can get these passed and move on. So
Would
is there
we
anybody that would like to make a motion?
be able to do that with any concerns of quorum?
We have, Chelsea, did you count? 1, 2, 3, 6, 7. I count 7. Is that what you count, Chelsea?
Yes. And we just need 5. So we're good as long as majority present.
So we're
votes.
good.
Yeah, we're good.
Thank you for asking, though.
Yeah. I move to accept. This is Susie.
Thank you. Hi,
Rhonda.
Hi, Rhonda.
Yay.
Okay, so I move to pass along the minutes from February. Is there any opposition or questions about that before we vote? Great, so all in favor of passing the minutes? Say aye.
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 Any opposed? Awesome, we're moving on. Thank you all. Okay, the next item on our agenda is reviewing and approving the district budget for 2021. And I know that we sent this to you guys super late, and I greatly apologize for that, but as you can imagine, putting this budget together is a lot of work. And we had some last minute adjustments this morning. So we'll walk you through it and then answer any questions that you might have. So to start, we'll kind of back up a little bit just to give everybody a refresher about what this all entails. So the columns that we'll go over to the columns that are labeled cohort 1, cohort 2, and cohort 3. And just to give you a reminder that those are our contracted agreements that we have with our sites. And we're up to over 80 sites now. So we've got a lot of work going on, and it's a lot to track and a lot to follow and a lot to budget for. So that's what the cohorts are. And then the budget items in the middle, they follow the schedule in our financial executive portal that was created by the Healthcare Authority. And so you can see the use categories on the left are where we pay out of our budget that's in the financial executive portal. Then there's a little description about what each of those things are. And then the budget item shows a lot of the items in here are related to contracts. So we label them to match the contracts. That's where you'll see milestone 5A1 called improvement team. That matches our revenue sharing model that's in our contract. So that's what those mean. So you can see that we have allocated funding for the milestones for cohort 1, 2, and 3 for 2021. So what that means is we're this year, 2020, for cohort 1, they started year 2. So we're offering a year 3 to them for 2021. And then cohort 2 is halfway through their year 2. So half will funnel that into to 2021. And then our cohort 3 sites are working through their first year in 2020. So we'll offer them a second year in 2021. So that's kind of how this all funnels down and correlates to the contracts for the ones that are labeled milestones. The PTW membership, CRC board participation, what that means is that for our practice transformation group members and our community resilience campaign and our board members, we offer them some compensation for attending those meetings and taking away from their daily routine. So that totals out to $138,000. You can see in that total column on the far right. The next section of provider performance and quality incentive payments, that's all milestones that are related to the contracts as I talked about before. Let's scroll down a little bit, Chelsea, please. The next section, value-based payments. All of those payments are related to milestones in the contracts again. So you can see how they all correlate and go across on each cohort. Milestone AA1, you see that says year 1 only. So we only make those payments to the providers in the first contracting. So they've all received that because they're all through their first year. Next section, population health management. And again, most of that is milestones related to contracts. You can see the workforce training is blank. We funded that last year. We're doing something different this year that you'll see further down, so we're not funding that this year. Our HIE contracts, that is for, we contract with the Health Commons and the CSI, which is the reporting platform that those of you that are working on our contracts are very familiar with. And then a few other things that we're working on with Kennewick Fire District and a direct messaging resource. So we budgeted $300,000 for that. And again, you can see that in the total column. Chelsea, can you scroll for me, please? Thank you. So project incentives, again, this is all tied to contract milestones. That totals $1.2 million for those milestones. Behavioral health integration, so that is our integrated managed care funding, which there isn't any IMC money for 2021. So we took, Chelsea, there was, I think we ended up with the wrong version. So there was wording in there in the budget, so I apologize for that, in the milestone area where it talked about, we took the funding that we would have gotten from IMC, which we didn't, and we're using the district money to fund those milestones for our behavioral health agencies. So I'm sorry if that's confusing, but we moved it up into the project incentives and the other milestones for the contracts that we just talked about. So they are still getting money for that, and it's just over $1 million that they're still getting for the behavioral health for cohort 2. The funding is just coming out of our district money instead of the integration funds because we don't get any in 2021. So I hope that's not confusing. Community health worker training fund, $35,000 that we put into that for this year. And that we'll talk about a little bit further down. And is Carol, hopefully Carol's still on. She can talk about that program. I don't see her. Looks like we lost Carol. I'll try to.
Lost Becky. I lost.
Are you still there? Okay, good.
But okay, I called in, so.
Okay, good. I was hoping that you could talk about our community health worker program.
Sure, whenever you want me to.
Yeah, go for it. So we're on the line that has the training fund of $35,000, and then we'll get to, if you scroll a little more, Chelsea, there's a big chunk of money where we're going to do, there it is, community health worker internship program for $850,000. So I'll let Carol talk about that.
So we presented this idea to the workforce committee last week, and they were very intrigued about this idea, but we were very, very inspired by a presentation from Becky Betts from Providence Walla Walla Hospital System, who, and FQHCs have been using care coordinators, community health workers. They have different names for them for a long time, and I'm sure Rhonda would vouch for their value in the workplace. But we've been trying to figure out, because we are really following the patient-centered medical home model of care, of how to implement and promote community health workers within the care team in major health systems. So we are going to model this idea around the behavioral health internship program that we funded last year for $850,000. So the $35,000 would be intended for training to help Diane Halo get up to speed. In fact, Rhonda just sent me a great link this morning to the Community Health Worker Leadership meeting that's October 7th. That's the one that's in English that that will be provided. And I guess there's a budget proviso in the 2021 budget for some community health worker funding. I don't know what it's all about, but that's intriguing. It's good timing. So the idea is to offer training for Diane Halo, our staff, to get trained up in learning how to be a mentor to community health workers, and then try to contract probably with Providence and Becky Betts to see if she'd be willing to actually do the training for the community health workers. She has a fabulous program in addition to the Department of Health 40-hour program. She offers other training. Anyway, so that's a little bit about the community health worker training and the fund that is listed further down for $850,000.
Thank you, Carol, for that. So continuing on, we, as some of you know, you attend our learning collaboratives, and so we're going to be, we put $200,000 in the budget for that. And then down to the community health fund, some of you were involved in our community health fund this year and last year, or maybe you attended our learning collaborative where we talked about it, but we put $1.3 million in there for that again for this year. Our community paramedicine program, again, is another really exciting thing that we're working on. We budgeted $1.5 million for that. Carol, do you mind talking about that as well? You described that a lot better than I do.
The community health fund, basically to address the paramedicine program. Sure, I'm sorry. Yeah. So this has been a long held idea by Greater Columbia ACH. When we originally sent out our current state assessment, we noted that there were a considerable number of public safety fire districts that had wanted to partner with Greater Columbia, and we were trying to figure out, so how do we offer a program to our paramedics or our paramedics wannabe within our region, so that we can link them into providing services. And Sam Wardell really is the expert on this, and looking at the community paramedicine program, there's lots of things that community paramedics can do in terms of prevention, blood pressure checks, home assessments. They're kind of the first responders, and prior to transporting patients, they do an awful lot of work on the ground. And so they were really interested in, I think, partnering with Greater Columbia, and we have an opportunity, we think, to tweak our toolkit to kind of transform itself into a community paramedic program, so that we would be offering funding to help 10 fire districts participate in a program that would help them understand how to use collective medical, how to link in with hospital EHRs. Really, Sam is the one that knows more of the program, but the thought is just to reserve some money for especially those rural paramedic or rural fire districts to help them receive funding to give their fire districts some training on how to promote prevention and, you know, maybe even provide workshops or health screenings at fire districts. So we really haven't fleshed out the program yet. So we just put it in the budget to see if it's going to fly. If you guys have any ideas around that, it's because this might be the first time we've ever really talked about it. And again, Sam is collecting all the information about other similar community paramedic programs that we're going to model this one after.
And Carol, I just want to add real quick, just an initial look at all of the metrics they cross-apply to our current toolbox.
Yes, Sam, would you want to add anything more about what you've discovered with the community paramedicine program?
Yes, one of the most beneficial things is they have metrics that they're accountable to in most states. Whenever they're certified, there is a reimbursement for that. But when it cross-applies to what we're actually doing, it really is the metrics that are more around inpatient utilization, ER utilization, and also the care coordination efforts. And so the metrics are identical to what we're currently reporting in order for our providers to get some sort of reimbursement or meet their metrics in our state.
Sam, this is Rhonda. Can I ask a question?
Most definitely.
So I think this is great. You know, the programs that I've heard about, and certainly when Eric has presented about it, you know, it seems to work really well with publicly funded paramedicine programs. Have you found any where the ambulance service or the paramedicine programs are privately owned?
I have. And doing the research on it, there was one in Michigan and another in California. But again, all of them that I have seen, they're actually worked with their health department or within their Department of Health and Medicaid departments to get some sort of reimbursement based either on A, piloting, or B, some sort of shared savings, or C, an actual fee schedule. And there's a lot of different models you can look at. So, you know, whether that they're working out of the primary care office and then they're going out into the community, or whether that they're working with the ambulance services and going out into the community. But there was 3 different models that were really that shown that the greatest benefit for the communities. And so I sent all that information to Eric as well as the directors and just kind of getting his feedback, and we're going to have a meeting on that. He's been off for 2 weeks, so he just recently returned this past Monday, so definitely going to set up a meeting, get some more information, and we can share that as soon as I get that.
Okay, thank you.
You're welcome.
Thank you, Carol and Sam, for that great explanation. Are there any other questions for them before we move on? Okay, so the next line item is our local health improvement networks, which most of you know about. Those of you that don't, those are 7 organizations that we have contracts with to work with community-based organizations to kind of help be some second set of arms for the ACH, because as you know, we cover 9 counties and it's a lot of work. So we rely on the LENS to help us. So we give them funding every year. So that's budgeted for $210,000 total for 2021. We just talked about our community health worker internship program. We are not funding the LENS training fund this year. It was not well utilized last year, so we didn't put money in the budget for that. The community resilience campaign will not be 2021, it will be 2022, so we don't have any money in there for that. And then we always keep a little extra for contingency. And then the next line is tribal investment, and Carol's working with the Yakama Nation to work on the CHAPS program, which again, Carol, I don't know much about that. If you want to talk about that a little bit more.
So maybe Rhonda might remember when we had, excuse me, Sue Stewart Dr. Maxine Janice and Kathy Saluskin attend our board meeting. Gosh, it seems like it was just yesterday, but I think it was at the beginning of the year, to talk about the Community Health Aid Program, CHAP. And the CHAP is a curriculum that comes, it's proprietary, that comes out of a university in Alaska. And what we would need to do is to purchase the curriculum if we were to try to put it in another university setting. And so Maxine Janice, who's affiliated with Heritage University, is very interested in implementing the CHAP program at Heritage University and bringing that education and training to the Yakima Nation. The CHAP program has 3 primary programs: the Dental Health Aid Therapist program that we tried to fund a few years ago, and then it ran into some issues with CMS because the health aides were only going to be used working on tribal people and not offering services to Medicaid people. There's the community health aid, which is like a community health worker, and then there's a behavioral health aid. So these 3 programs come under the curriculum, the CHAP program curriculum. And so we're very, very interested in helping fund the curriculum, and I think that Southwest ACH might be interested as well. So when we spoke to Sue last year, the cost of the curriculum was $400,000. So we put in $200,000, hoping that maybe we could, get some matching funds from SWACH, and then maybe the Yakima Nation would be willing to also invest the money into this program.
That's a good idea.
Thank you, Carol. Is there any questions for Carol on that one? Okay. Let's see. So we don't have shared domain investments anymore. We probably could just take that out, Carol, don't you think?
Yes. And now the shared domain program was used as part of the agreement to cap the district payments. In order to achieve the full amount of the district payments, the state has to have a match of non-governmental funds. And so we were using the public hospital districts to have those investments. Now they're using the Medicaid Quality Improvement Program as the match. And so those shared domain 1 investments are no longer needed because we're matching the CMS money with MQIP dollars. So you're right, we could probably take that out.
Thank you for that explanation. And then the last 2 boxes, project management and administration, are the salaries for our staff. So we take that money out of district and put it down into our operations budget and for payroll for 2021. So that's it. The grand total of the budget for this year is $14.8 million, which is a little less than last year. So I know that was a lot of information and you guys are just seeing this fresh this morning, but are there any questions or anything you want us to go back over or elaborate on or talk about again?
So Becky, this is Rhonda. Just a clarification up on the milestones, and all of those, the formulas and everything, really nothing there really changed, did it?
No, nothing's changed.
I mean, yeah, that's what I thought. So no, looks great to me.
That actually, the formulas, if we send them the live link, Becky, they would be able to click on the cells and see the formulas, Rhonda. So we're happy to do that because year 2, which is the contract that that Yakima Neighborhood Health Services is currently operating in, year 3 revenues are half of what year 2 was. So the total revenue sharing schedule for year 2 was around $149,454, some odd cents. Year 3 for cohort 1 is half that amount, so it's around $75,000. We just simply couldn't afford, another round of $150,000 payments for 83 sites. So in a revenue sharing model that we worked up a couple of years ago, it's a step down in payments from year one. It was like almost $300,000 to year two is $150,000 and year three is $75,000. So there is a step down in payments, and the milestones achieve half of what they did in year three than they did in year two. But we'd be happy to send you those links. And when you get your contracts for year three, that will be coming up after this goes through the budgeting process with the board of directors, you will be approving that revenue schedule, and it looks exactly like last year's, except it's half the amount.
Yep. Okay. No problem.
Okay,
I should
thank
say
you.
understood.
So, Rhonda, let me ask, because I had this question for Sam yesterday. I mean, for $75,000, is this program still valuable to organizations such as you? Because I know you guys have millions and millions of dollars that you work with. Is this still enough of an incentive program that would keep providers interested in pursuing all of these different milestones?
So yes, for us, because we, for a variety of reasons, but because we're a community health center, we are charged to maintain and continue our quality initiatives to be a patient-centered medical home. And so, in fact, our admin team was just meeting this morning, and Michelle, October is a big reporting month, but fortunately, because these milestones are all in line with our alternative payment methodology with the Healthcare Authority, the Bureau of Primary Health Care, these milestones all line up with that. So fortunately, they're all pointing in the same direction. So because of that, it's very much worth our efforts. One of the things this has helped us do is add another person, for example, to our quality assurance team. It's helped us because the measurements, it takes a ton of effort to monitor, to develop the measuring capacity and to monitor our QA activities. And that's a big piece of what this program has helped us do. If the measurements, were off in left field, I would say no. But everything that's in this program, which is why, building this on the PCMH model made so much sense. So anybody that's striving to achieve a certification for PCMH, they should be very thankful for this, because nobody else is giving people money to help support this effort, because it's a very expensive endeavor to become certified as a PCMH entity. So the answer is an energetic yes.
Well, Becky, I hope we recorded that, because that's the kind of element.
I'll say it again if you want me to. But
I got it.
Lots of people have asked me, and I have told them yes. So I would be happy to say it again. It just makes so much sense.
That's music to our ears, and that really, is very heartening to hear, because I think that, we've heard that one of the great things, the benefits of this program, is that those measures do line up with CMS and PCMH. And so I give credit to Sam and her brilliance of putting this program together, that it works so well for our provider organizations, which, in my estimation, that's what the delivery system reform incentive payments are supposed to be about.
Thank you, Carol. But I really put all the efforts towards, you can say and do a lot of things, and you can, facilitate a lot of things, but it's really the providers that make it work. So I appreciate them as much, and my teams I work with.
Thank you, Rhonda. Thank you, Sam, Carol. So next up is this budget needs to go on to the Finance Committee. So what we need from you guys is a motion to move it on to the Finance Committee. And then the Finance Committee will hopefully give us a motion to move on to the board. So we have our board meeting next Thursday. So again, I apologize. I know this is super rushed, but so if you have any more questions, please ask them. Otherwise, I'm going to ask for a motion to move this on to the Finance Committee, please.
So moved.
Thanks, Rhonda. Is there a second?
Second.
Thank you. Who was that, just for the minutes?
Susie.
Okay, so let's vote. All those in favor of moving the draft district budget for 2021 onto the Finance Committee, please signify by saying aye.
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 Any opposed? Awesome. Thank you all so much. I appreciate it. Like I said, we put a lot of hard work and probably some tears, I think, Carol, don't you? Into this budget.
It was fun to develop. I felt like a Dan Vizzini.
Okay, so next we just wanted to show you, because we haven't met very much this year, we just wanted to show you the payments that have gone out to the providers. So I've just put together a really quick spreadsheet just to give you a dollar figure for this year, what we've paid out. So, and as you saw in the budget, we had those categories: administration, community health fund, integration, provider engagement, provider performance, health system, and community capacity. So these are the actual categories in the financial executive portal where we make our payments from. So that's why we put the budget together that way, so that we can pay out of the right funds when we pay out our milestones to our providers. So, so far this year we made two big chunks of payments. One for quarter one in March, and then we just did the quarter two in September partially. We still have a few kind of straggling payments out there that we need to make to finish up the quarter two, but most everybody received their quarter two payments. It was a little over $2.5 million. So this is just, again, I pulled this straight out of the financial executive portal, just a quick little spreadsheet to show you that so far this year we have paid out to our providers and our payroll for our staff of $13.1 million. So we're pretty excited about that, especially for Q2, because that was all during the pandemic, and everybody continued to do some really great work. And Sam and her team continued to make phone calls and work with their providers, even though we couldn't do it in person. We've had so many Zoom meetings that we've had to get different platforms to accommodate all of our meetings for all of our staff since we've been home. So it's really great work, you guys. So we just wanted to share that with you. So no action items on that, just a FYI. And I think we're on to the last thing. Yeah, last thing is our chairperson took a different job, and so he's no longer in the healthcare industry. So we need a new committee chair. So my ask to you guys is to think about someone that you that's on the committee that we might want to nominate, or somebody new that you know of. Like I said, we lost a couple of people besides our chair. We lost a few other people to retirements and other needs that they've taken on. So we're looking for chair nominations as well as any new committee members, because we are a little light on both. So if you guys could think about that. For those of you who went through this with us last year, what I need is a nomination and a resume. And then I talk to the person, Carol talks to the person, and then we kind of, and then we send them through our process of getting them nominated officially by this committee, and then the finance committee, and then the board. So it's a little bit of a process. So if we could work on that in the next couple of weeks, so that we could hopefully get that together by our November don't know what month it is, our November meeting. I really appreciate that. So just email them to me. You guys have my contact information, or even to Chelsea. And so we can kind of get that together. I'd appreciate it. Are there any questions or anything anyone wants to share or bring up or discuss or talk about, since we haven't seen each other in so long? That's really all the agenda items that I have. Carol, do you have anything else for the group? Sam, any of our staff? No?
I do not. Thank you.
You covered it well, Becky. Thank you.
Not. Okay, I'm gonna give you guys back 20 minutes. Yay.
Yay.
So we'll adjourn the committee. Thank you all so much for coming. It was nice to chat with you again, and we will see you next month, if not sooner.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.